Hi guys, today I want to talk about rotator cuff versus subacromial bursitis. Just had a patient in with a shoulder problem for 5 years. Basically it has been to 3 other physiotherapists who diagnosed a rotator cuff tendon issue. He's been doing a lot of exercise with TheraBands. It sort of makes it no better, slightly worse. And basically I've diagnosed it's subacromial bursitis. A few things about bursitis versus the tendon. Basically, tendinopathy, most tendon pain will stay local to where the tendon attaches, i.e. on the lateral aspect of the shoulder. Yeah. Bursitis pain normally is diffuse in nature around the anterior lateral aspect of the shoulder. It can travel down to the elbow and even below to the hand. How you test for it, there's distinction tests for it, but you also do the other rotator cuff tests as well. So I've got Heidi here as my assistant. One stand, please. So basically, when most people test for shoulder rotator cuff issues, we test abduction at 30 degrees for supraspinatus. Now all these tests, they all cross over. No one test is great for everything, but abduction is for lateral supraspinatus. So just push out already. So obviously if you had pain and discomfort, it would be weak. That would be the case with bursa pain as well, it may be more painful. Lateral rotation, push out, is testing the infraspinatus and the teres minor. And then medial rotation, pull across your body, test more for subscapularis. Now, if someone's got subacromial bursitis, normally it's painful on the abduction and the lateral rotation testing. Now, sometimes people think, oh, that's a rotator cuff issue. May not be the case. So then if we do a distraction test, which I will show you in a second, that differentiates between a tendinopathy of the rotator cuff and the bursa being involved. Because when we do a distraction, we distract the head of the humerus in the socket, so we're taking the pressure off where the bursa is. And if the person is able to push out with more pain, more power and less pain, well then you can indicate that the bursa is involved. The tendon may still be involved as well, but the bursa is definitely involved. And with this gentleman, that was the case. So we injected him with the steroid, and hopefully that will be the end of his pain. So to show you how to do the distraction test, if you come around back, please. So this person would have been painful, as I said, on abduction and lateral rotation. So then if we distract the head of the humerus, push out to the side, please, Heidi. And if there's plenty of power and no pain, you would suspect that the bursa is involved. And similarly, if you distract and you laterally rotate, push out, Heidi. Push out, push out. Again, there's no pain and plenty of power, you would differentiate that being the bursa being involved. So I hope that clears up a bit about rotator cuff tendinopathy and subacromial bursitis.